and how important this day will be. As you are well aware, concerns over the COVID-19 continue to grow across the state and the nation. And as governor, I have no greater responsibility than to keep all Missourians healthy and safe. In our press conference last night, I said that we had not yet declared a state of emergency, and that my administration would continue to evaluate the situation and consider all options available to provide the necessary resources. After further consideration, following last night's press conference, we have decided that declaring a state of emergency is the next appropriate step to protect public health. So today, March the 13th at 4:30 p.m., I signed Executive Order 20-02 declaring a state of emergency for Missouri. I want to be clear that the declaration has not been made because we feel our current healthcare system is overwhelmed or unprepared. I also want to make it clear that the declaration is not intended to close public schools. Schools should seek the guidance of local health officials when thinking about closing their schools. The purpose of this executive order is to allow more flexibility in utilizing our resources and deploying them around the state where they are most appropriate. By signing this executive order, I am invoking the Missouri State Emergency Operation Plan. This executive order will enable me to waive certain state laws and regulations where necessary and direct state agencies to report any unfair market practices. This will also provide access to up to a combined total of approximately $7 million in state funds beyond the federal funds we expect to receive. In addition to declaring a state of emergency, we are also taking steps to expand our COVID-19 testing capabilities by coordinating with the University of Missouri and Washington University labs. We have shared positive COVID-19 samples with Washington University that will allow them to create a control and conduct testing themselves in the near future. We are also in the process of doing the same with the University of Missouri. This should increase our testing capabilities by thousands here in Missouri. And we greatly appreciate these universities for offering their assistance in addressing COVID-19. Our state lab will also be receiving more tests from the CDC very soon, pushing our capacities to 1,600 patient tests. We know that testing has become a great concern, and I want Missourians to know that we are working with some of the best resources in the state to address this, whether they are public or private resources. As I mentioned before, the primary purpose of this emergency declaration is to provide greater flexibility in allocating our state resources, not because the local health providers feel they are overwhelmed. However, in many of our communications, we have heard concerns over the availability of personal protective equipment for responders outside of healthcare providers. We are also working to address these concerns. We have been in communication with the Missouri Foundation of Health, which has a relationship with many of Missouri's communities and a history of supporting public health. We will be working jointly with them to try and fulfill the needs of PPE in our urban, suburban, and rural areas. We are also in the process of reviewing federal guidance allowing additional flexibility in health insurance coverage and unemployment benefits. We will communicate more on these items as we receive better clarification. Finally, we believe we will have the capability to deploy temporary structures in accordance with coordination with SEMA and the National Guard should the need arise. Again, I want to assure you that we will continue to take all steps necessary to protect the people of this state. As of today, we have had 2 more individuals test presumptive positive for COVID-19 in Missouri. We are currently in the process of making notifications. We have no other details at this time, but we will share them as soon as notifications have been made. As of today, a total of 94 individuals have been tested for COVID-19 in Missouri. 90 of these tests have been negative. We are in daily communications with the Missouri Department of Health and Senior Services, our lead agency here in Missouri. I've been participating in regular briefing calls with Vice President Mike Pence and other governors for updates on the federal level. From the state and local level, I have been holding regular briefing calls with mayors, county commissioners, and emergency personnel from across the state. We knew this was coming, and we are taking every precaution we can. We are actively taking steps to protect those under the state's care. As a precautionary measure, the Missouri Veterans Commission has restricted access to our veterans' homes across the state. Yesterday, the Missouri Department of Corrections announced it is suspending visitors at the state correction facility for the next 30 days. And today, the Missouri Department of Mental Health also restricted visitor access at state mental health facilities. We also know that there will be people traveling and returning home to Missouri. We are aware of this, and we are prepared to handle these situations. We have an excellent healthcare system, equipped and trained professionals, and I am confident that Missouri is well equipped to deal with the coronavirus. However, I want to emphasize that at the end of the day, we are all responsible for our own actions. If you're told to self-quarantine, it is very important to follow those instructions. My administration will continue to evaluate this situation and all options available to provide the necessary resources, and state government will continue to operate and provide services to our citizens. Please know that this situation changes daily. We will continue to be proactive, and we will continue to work closely with federal, state, and local health officials and emergency personnel to provide you with the most accurate and up-to-date information. With that, I'd be glad to take a few questions here. Kelly?
You mentioned that you were accessing $7 million. I presume that's from the disaster fund. Do you have plans to actually spend that, and if so, on what?
I think we'd be seeing where the needs would be to be able to utilize that money. Basically just freeze it up where we can if we needed to. And there's multiple reasons where we could be utilizing to spend that money, whether that's for equipment, whether that's for supplies, whether that's for medications, or even whether it could be for test kits.
Now, where did the 2 presumptive positive cases come from?
Yeah, we're in the process of notifications today. We'll release that a little bit later today where they come from, but we're in the process right now of making sure all those notifications have been made. And we haven't been able to do that at this time.
Is there a point where you'll let employees work from home? State employees?
We'll consider all options, but right now it's important for state to be open for business. We need to be the front line here. I mean, the governor's office, for example, we're going to be open every day, and we're going to be doing business for the people of the state. Because all the operations of state government has an effect on everyone out there in the state. So it's very important to me to make sure that all those facilities are open and prepared to be able to handle the public at their time of need also.
Okay, Ryan?
Was this community spread, the latest you said?
We don't have the information on all we know is they're presumptive positive right now. I think later on today, we'll be able to release that information with the Department of Health, should be able to release that. But right now, we're just in the process of notifications.
Brian?
Governor, if you could clarify, 90 have tested negative, 94 overall, and I assume 3 still need to be confirmed by the CDC if you could confirm that. And you mentioned temporary structures. Do you mean temporary hospitals? What are those temporary structures?
You know, there'd be a number of things. They could be hospitals. If it ever come to that, we could use that. But I think testing sites also, you could have temporary testing sites, wherever that might be. If we wanted to make that more availability when that time does come, when I think when the process would kind of catch up with the demand, we might be able to do more testing at different locations around the state.
Governor, can you talk about the decision regarding schools?
Yeah, I think the school issue is a local issue. I think for what we do know status-wide, probably our younger adults are less likely to be affected by the coronavirus as some of our older people. So I think that's a local decision. I think that's what it is. They pretty well know the facts here. And so far, and thank goodness, we haven't had anything in our school systems.
Governor, we're seeing other states shut down schools. Do you all have any additional information you can share as to why we're making the decision to keep schools open?
Well, right now, we've not had any cases whatsoever been in the schools. We know that for the students in the school, for that age bracket, is less likely to be affected by the coronavirus on that. And right now, again, I think that's up to the local levels to make those decisions.
We've also seen other states who have put restrictions as far as crowd size. Any thoughts there?
Again, I think your mayors, I'm well comfortable with the mayors and decision they're making across the state. They don't know their areas better than anybody, and I think they can make those decisions on that right now. I think we make recommendations every day when we think, you should limit that, and we're trying to tell people to limit from crowd gatherings, but I think to put a number on it.
Sure, some people might say, you're the governor, they're expecting, the local agencies and the local leaders are expecting you to give some guidance.
Well, that's not come to my attention, and I'll say this, but I'm going to be meeting with the mayors next week. For example, we're trying to set up meetings with the mayor of Kansas City. We're going to go to those local areas and figure out, okay, what is it you want me to do as governor, and what do you want us to play that lead? But again, I think the responsibility of the local levels has to play a part of this.
Is there really corrections in the hotline to allow out-of-state area codes?
Pardon me, I didn't hear the question. I'm sorry.
Correction to the hotline to allow out-of-state area codes, since most people are working off of their cell phones now.
Yep.
Yeah, thank you very much. Again, as the governor has always stressed, communication is really important. So we worked with our long-term provider at that entity, Cardinal Glennon, and set it up on Wednesday. I reviewed all the scripts. I would highly commend you to look at them. We put them on our website so you can actually read what we have scripted to tell people. It's about 52 pages. Like I said, I'm impressed with how detailed it is. It was brought to our attention today that you couldn't use outside area codes. That was unexpected to us, and so we are correcting that today. But I don't know if it's been corrected at this moment, but when I left to come over here, it was in the process of being corrected. But again, I would just stress this is a long-term provider we've worked with for a long time. I'll be there tomorrow. I'm visiting tomorrow morning. I'll be there actually 12:30 to go by and see them. But I would highly encourage you to use that. It is really everything I think you would want to know about COVID-19 in Missouri. And if you have trouble getting through on the line, sometimes when I call, they'll say go to the website. All the scripted answers about anything you'd want to ask about quarantine or isolation or pregnant women, it's all there in written form. So I'd highly encourage you to use it.
You mentioned temporary structures set up for SEMA and the National Guard. Can you talk a little bit more about what forms those might take?
Yeah, I think any form. We use them for testing locations around the state. We might want to set them up temporary-wise. I mean, you've got medical resources there, whether it be a medical hospital if we ever was to need it. But I think all those resources come available then. We would be able to use it. But I think practically would be the more the thing of a testing situation there. I also think when I made my remarks, it's really important. I can't emphasize enough how much it was for when Washington University and Missouri come forward to help us with those testings. Those are going to really speed the process up for us. It's going to make us a lot more ability to get people tested in the state. So I really appreciate them stepping forward and doing that and be the leaders in the state for that.
And one follow-up, when will the University of Missouri be getting those additional resources to begin performing tests?
Yeah, we're in the process of getting the certification. The equipment is there. Our anticipation is that we Would we need to, we could increase our capacity to about 1,500 tests per day. There's not that need right now, but we want to make sure that we're having appropriate preparedness in case that should arise.
Governor, do you have any idea about how many tests the state is capable of doing a day? I know there was a concern over not enough test kits.
Yeah, let me let the gentleman who runs the lab there will be the best guy to answer that question.
Thank you. That's a great question. I'm happy to offer the answers to that. So currently, we can run at a minimum level about 68 tests per day, but we can ramp that up depending on the number of specimens that come in and depending on the load that we need to address. We can run about 168 to 200 per day, and as we need to, we can bring in additional resources, whether that be personnel, bring in additional instruments throughout the laboratory, and we can run several hundred a day quite easily. Thank you for the question. It's a great question. I hear there's a lot of testing questions out there in the world.
Governor, earlier today, President Donald Trump also declared state of emergency. He said he was freeing up $50 billion that would go to state and local governments. That's a lot of money that could be coming Missouri's way. If we really need it, what would we do with it?
Well, I think, one, we're trying to prepare for the money, the $13 million we're getting already that's coming this way. And I haven't heard the press conference today, to be right honest about it. We've been here at the office, so I'm not sure what the president did say or what is. But, I mean, any type of resources we can get, we're always going to be looking for that, however we can protect Missouri citizens. But I think more importantly, just how do we make sure we get the available test kits out there? How do we get that out there where we're making people much more comfortable with that? That seems to be the main issue we hear every day. So hopefully that money can be utilized to that, whether we utilize that if it comes to the state for the private sector to buy students of our own. We'd like to have that opportunity, but I'm not sure what all the president said today.
Did Missouri need more than the $13 million that's getting directed?
Well, I think that's an unknown question for all of us. I mean, we don't know where this is going at this point, but I think we have to prepare for the worst, and we hope for the best. And I think by God's grace, hopefully this stays in a reasonable arena where we can manage it. And I think right now we're well aware of that, and I think we're doing what we can in the state of Missouri. Again, with the medical professionals we have in this state, I think we're preparing every day to try to get better and better at what we're doing, and I think we'll continue to do that. So all the resources we can have on hand to make sure if things got worse, we want, and we're going to be able to utilize. So I'm sure we'll be able to utilize the funding in some ways, whether that be through testing, whether that be equipment, for multiple reasons.
Okay, we'll take one more question.
God, what do you say to those who feel the declaration should have considered?
You know, one of the things, you've got to evaluate your situation. Every governor has to evaluate what his state feels like. At the time, we had only had one presumptive positive, and now we just had our second one. And then, of course, today we had them during the press conference. But, you know, you got to rely on, okay, what is it you're going to do a declaration for, and what is the need for it? You can make a laundry list of things you could do, which a lot of people do, but the reality of it is, right now, to me, in a state of emergency, is what are you going to do for the people that we need to take care of right now for public safety? That's the main thing right now. How do I get those services out there to those people to be tested, to make sure they're comfortable with that? That's the priority one for me right now. And that's why I think that declaration is so important and why you do it. You know, so, and hopefully we're going to free up the resources to do that. And I think when you can see all the people up here today with the universities coming on board, that is our main goal, is public safety for this time being.
Okay,
Thank you very much.